All right, joining us now is Texas Governor Greg Abbott. Governor Abbott, thanks for joining us on this Monday afternoon.
Sure, my pleasure. Thank you.
All right, Governor, so we're seeing an increase in positive cases across the state and here in the Valley, as well as hospitalization rates. They're also up. Do you think the spike in cases is in direct result of easing restrictions and opening up? And is this concerning to you?
Listen, anytime there are more people testing positive, anytime there are more people in hospitals, that's a reason for concern. However, because of what I'm about to tell you, it's not reason for alarm. We've been able to identify the reasons why we have seen the increase in people testing positive. Some of it is already being reduced from the number of positive cases. For example, the past couple of days, the number of positive cases have gone down, and let me tell you why. One thing that led to a spike in the increase in number of people testing positive was we had gone through the process of massively testing people who were in jails and prisons, and that led to a higher positivity rate and a spike increase in the number of people testing positive. We've also seen an increase associated with the Memorial Day holiday. And let me tell you something about the Rio Grande Valley. We are beginning to see for the month of June an increase in the number of people testing positive who are in the age group of the 20s, meaning between the age of 20 and 29. What we're seeing there is that people of that age group, they're not following these appropriate best health safety practices. They're not wearing face masks, they're not sanitizing their hands, they're not maintaining safe distancing practices, and as a result, they are contracting COVID-19 at a record pace in the state of Texas. So we are strongly urging everybody to follow those safe practices. Understand this last fact, and that is COVID-19 has not left the state of Texas or the U.S. or the world. It is still here until we have medicines that can treat it. You are putting your own life on the line. If you go out and do not follow these safe practices, you're increasing the probability that you will get COVID-19.
And Governor, you recently disagreed with the Bexar County judge request to make usage of face masks mandatory, citing personal responsibility. You disagree with the judge's request by saying you believe in personal responsibility, not government mandates. But we have many state laws, such as usage of seatbelts that are mandatory auto insurance. So what's the difference, since you agree that using masks can prevent the spread of COVID-19?
Listen, wearing face masks is important and highly recommended, just as I did to your audience right now. And every public official in the state of Texas should have a responsibility to make sure they advise the public about what the best health strategies are. And everyone should wear a face mask, understanding that if you do not do that, you're exposing yourself to getting COVID-19. This situation, however, is different than these other types of laws that you talked about, because this situation is where people should not be put in jail for failing to wear a face mask because of a pandemic that they had no cause, nothing they did caused this. Because every person has the individual capability and responsibility of being responsible for their own health care, they should be wearing this, but I don't think putting them in jail for failing to do so is the right thing to do.
All right, we are in phase 3. Do you foresee another shutdown for Texas? If so, what would have to happen to have another shutdown?
You know, I don't foresee having to have either a shutdown or a ratcheting back in the way that we've opened up businesses. We have several strategies that we can utilize before things like that are needed. The first is making sure that we are educating the public about the fact that COVID-19 hasn't suddenly disappeared and following safe practices. The second is making sure that we have plenty of hospital capacity available. Listen, people, as they go back to work, every doctor has told the public that as the economy opens back up, people will be contracting COVID-19 at a higher rate. The main thing that we have to do is to make sure we have the hospital and healthcare capacity to be able to deal with everyone who does test positive. And we have plenty of hospital capacity as it stands right now. Our goal is to make sure we maintain that hospital capacity to treat anybody who tests positive for COVID-19.
All right, let's talk about some testing. I know you mentioned testing briefly earlier in this interview. That's ramping up across the state. We've seen here locally new testing sites opening up almost daily. Is the state near the number of daily tests you were hoping for, and how long is it taking to get those test results back?
So for the past week, we are at or above the number that I was talking about. On average for the past 5 days, we've been doing probably around 30,000, maybe a little bit more than 30,000 tests per day. There was a time period a week or two ago, and maybe sometime before that, when it was very slow getting some test results back because of some private labs. Understand this, there are two types of labs. There are public labs and private labs. The public labs turn around the test in 24 to 48 hours. Some of the private labs were dragging their feet and taking 1 to 2 weeks in getting results back. We are no longer using those private labs that were moving slow, and the turnaround time period for getting the test results back from the private labs now is about 2 to 4 days. And so bottom line is getting the time period back for getting the results back of your test is getting shorter and shorter.
Now, some universities have announced they plan to reopen in the fall with guidelines. Do we know yet if school districts will reopen in the fall? And if so, what are some of the guidelines for schools to follow?
School districts will reopen in the fall with students in classrooms, with teachers and other fellow students. There will be higher safety standards in place than what existed when they opened up last year. The announcement for those reopenings and those standards probably will come as early as next week.
All right, Governor, we appreciate your time. Hopefully we'll talk to you soon.
We look forward to it. Y'all be safe.
All right. We'll keep it right here. We'll be right back.